we'll measure range of motion. So standard position is supine. Bjorn's waving. Hi, Mom. So when you eyeball this, Jamie, what do you think? Eyeballing that. How's it look? Does it look pretty straight? Does it look hyperextended or? Looks pretty close to zero, huh? I would say. Yeah. Okay, good. All right. So we use the lateral femoral epicondyle as our axis, right? And we go down the midline of the fibula with the lateral malleolus being our point of reference, all right? And we go down the midline of the femur with our greater trochanter, all right, being the point of reference. Okay, and it looks like it's zero. Maybe 1 degree of hyperextension. Okay. So that's passive, okay? If we, the other way you could measure active, okay, is you could have him lift his leg, do a straight leg raise, okay, and you could do it. You could have him measure. So this would be active, right? Extension, because a lot of times when people have weak quads, and you could just measure them like that. A lot of times when people have weak quads, right, they kind of lift their leg. They don't get that full terminal extension, right? So they kind of get stuck in that position. And again, you can kind of measure that, all right. And then we can have a flex. All right, so same, we have our lateral epicondyle, we have our lateral malleolus and lateral fibula, and then our greater trochanter and our mid femur. Okay, and is that as far as you can go, sir? Good, thank you. Very good. Excellent effort. 133 degrees of flexion. All right. So if you do it prone as an alternate, so this, what we did right now would be what you do for your friend. Okay? So you put the little thing underneath, okay, measure them, and then have them flex. That's what we do. But in the clinic, again, right, so turn prone. So in the clinic, you may see them, okay, measure flexion this way. All right, so let's see if we have a difference. What do we have? 133 degrees, right? So we actually do have a difference. So I'm using the same landmarks, the lateral epicondyle, midline of the femur, and it's as far as you can go. Okay, so he has 124 versus 133 supine. All right, so you might want to look at that and experiment with that. Okay, sitting on the edge. Okay, so sitting on the edge, you may want to